In today's Health Watch, we are focusing on a painful virus you probably have heard of. We're talking about shingles. It appears as a painful rash and can sometimes lead to serious complications. It's actually very common. In fact, 1 in 3 Americans will get shingles in their lifetime. And about 8% of cases, the illness spreads to the eye.
No.
Yeah, that's horrible. But a new study is showing promising treatment results. CBS News Chief Medical Correspondent Dr. Jon LaPook takes us inside the science behind the research.
Dr. Elizabeth Cohn spent more than 30 years doing eye surgery.
It was very gratifying to take someone who can't see and help them to see.
But in 2008, shingles derailed her career. The illness comes when the chickenpox virus reactivates, causing a rash and nerve pain. Shingles of the eye can cause scarring and vision loss. That's what happened to Dr. Cohn, forcing her to stop operating. So this is an infection with shingles.
Yes.
And it's supposed to be clear.
Right.
Dr. Cohn, a professor at NYU Langone Health, where I work and her husband is dean, had an idea. Treat shingles of the eye with an antiviral drug for a year rather than the usual 7 to 10 days. 3 days ago, she presented the results.
When you saw these results, what was your reaction?
Phew.
Patients receiving placebo had a 44% risk of developing new or worsening eye disease over the next 18 months. With low-dose daily valcyclovir, or Valtrex, that risk was 22% lower at 12 months and became 26% lower at 18 months.
Are you concerned that this did not reach statistical significance for the primary endpoint at 12 months, but it did at 18 months?
I'm really not concerned about that. It can take a long time to kind of get those nerves back to a healthy point.
Dr. Christopher Starr is an eye surgeon who did not take part in the study.
This will change the way I practice from here on out.
I'm hoping that we help a lot of people. That is my ultimate hope.
Dr. LaPook, an eye surgeon who got shingles of the eye and had to stop surgery?
Can you imagine that? And then she was inspired to say, you know what? I don't want this to happen to anybody else, so I'm going to do this study.
Well, we have the research hot off the presses. She just presented this 3 days ago.
I know.
And so what is next for this?
Well, it's been submitted for peer review for publication. She's waiting to hear about that. And I just got off the phone with her. She said, you know, a lot of her colleagues are already using this because it's a generic drug that's relatively inexpensive. It seems to be safe over a long period of time. So it's such a terrible outcome if you get involved in the eye. You know, you can. In her case, she lost her 3D vision. A surgeon needs a 3D vision. And I don't want to end this without saying there's an effective vaccine.
Yes.
For people who are 50 and over, if they're immunocompetent, or 19 and over if they have immunodeficiency, if they have some kind of weakened immune system. It's more than 90% effective in people who have their intact immune system, and yet only about a quarter of people who are eligible take it. A quarter.
So that's a shingles vaccine for post-50. Why not, I mean, if it's essentially chickenpox, why not give it to kids so they don't get it in the first place?
So there is a vaccine to prevent chickenpox, and it does lower the risk of getting shingles. It doesn't go to zero, but it lowers the risk. And you know, there's a misconception about this. The way that you get shingles is, as a kid, you get chickenpox, and then your body sort of hides away the virus, but it's still in your body, and it can come out later. And when it comes out, it doesn't come out over your whole body. It comes out in what's called the dermatome, sort of like one side of the body, and it can really hurt.
I love the idea of the body hiding it away but not getting rid of it. It's like just under the rug. Look.
Your immune system's keeping it down.
Well, I'm so happy we're talking about it, Dr. LaPook. Thank you.
All right.